Glad you're here with us on Morning Express, and it's time for us to look at the state of the nation. Now, just to remind you briefly, I remember not too long ago we had an incident of a gentleman who spent 18 hours in an ambulance. I'll be refreshing your memory on what happened with a short story on that. But what does one do when you're caught up in a situation where you need emergency care? Do you go to your nearest hospital? Do you go to Kenyatta Hospital and then from there maybe get a referral? What really is the procedure that one is supposed to follow? So we're going to be talking about that. And let me first of all introduce our panel this morning before we go to the story. And I have Dr. David Misango, who is the Secretary General for Critical Care Society of Kenya. Thank you, sir.
Good morning, viewers.
And thank you for joining us. Then I have Dr. Abdi Mohammed, who is also the chair for the Kenya Medical Association in Nairobi, but also the CEO for Ladnan Hospital.
Thank you.
Great to have you. Now, gentlemen, I'll come back to you, but what I'd like us to do, first of all, is just a refresher of a situation that we had. And this is not a unique situation in that it's not just a one-off. This happens almost every single day. But the question that remains in our minds is, what do you do? Because again, don't forget, when you're in that situation, you're not in a frame of mind to think and make quick decisions. You need to have the information beforehand so that if it happens, you know what to do. But first, let's start with the story.
They yearn for compassion and care, considered a right for every patient who seeks treatment in hospital. But whenever the issue of money crops up, well, compassion takes a back seat as patients suffer negligence by the healthcare providers.
Sasa hata service hakuna. Hata madaktari wengi wamefungwa private. So tunafinyika ni kweli.
It is for this very reason that a young family is in mourning. The late Alex Madaga's family. He died as he waited for specialized treatment for 18 hours. This after being turned away by 4 hospitals, including Kenya's premier referral facility, the Kenyatta National Hospital. And although Health Cabinet Secretary James Macharia wants answers from the Kenya Medical Practitioners Board in 3 days, the Kenya Medical Practitioners Union seems well prepared with the answers.
If a hospital says that we do not have capacity or that we do not have the ability to offer you these services and then they refer you, there is no provision in the law for them to be punished.
Wanaweza kuacha hapo kama wewe ni mgonjwa wa kutibu, akuangalia ni nini shida ni nini. Sinaona hiyo. Kama mgonjwa nafaa ushughulikie haraka.
Before registration, all medical practitioners take the Hippocratic Oath, an oath that compels them to safeguard human life by all means possible. The oath reads in part, I will tread with care in matters of life and death, if it is given to me to save a life. Through the oath, the medics further swear, and I quote, I will remember I treat a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems. And so, what has happened to the medics thereafter?
There are a number of clerks and administrators who do their jobs well, but quite a number of them also, they don't have the empathy and they also don't have the ethics